Hello, so I thought today I would kind of talk about a process I'm going through about trying to figure out whether or not I am going to take pain medication to deal with my symptoms of fibromyalgia and rheumatoid arthritis. Um, Please excuse my hair. I'm in the process of locking my hair and I'm about 5 or 6 months into the lock journey, and it's a beautiful process, but it has the times where, the hair is doing its own thing, and so just work with me. Um, but I, so when I was first diagnosed with rheumatoid arthritis and fibromyalgia, I was immediately put on Lyrica. Now, Lyrica worked very, very well for me in the beginning. I took 75 milligrams every morning for 3 to 4 years. However, after about that 3 or 4 year mark, I can't remember exactly, I started getting the first noticeable side effects from the medication. I actually had zero side effects from the medication, and I was doing so well on the medication initially. However, I started experiencing pretty severe edema in my feet and lower legs to the point where it was painful and uncomfortable to walk. I was dealing with it on and off for quite a few months. I tried taking diuretics to help with the water retention, all the swelling, and we eventually realized I wasn't sure what was causing it, but we eventually realized it was Lyrica, so I had to go off of the Lyrica. That was pretty hard. Around that same time, I was prescribed tramadol, which at that time it was not yet a controlled substance. Yes, it did have to be, prescribed by a doctor. However, it wasn't, the class of controlled substance that it is now. That's a little bit harder to get a hold of. I didn't take the tramadol often because I tried taking just the one that I was prescribed at a time, and it just wasn't helping with the pain. So my doctor, knowing that I didn't really want to take any narcotics, sent me to a pain management specialist. This doctor is actually really good. I started getting facet block injections in my lower spine to help with the lower back pain and injury and arthritis in my lower back. That's separate from the rheumatoid arthritis, but it affects me extremely. And also the fibromyalgia is affected in the lower back as well. And so that doctor started me on the facet block injections worked wonderfully for the back pain. I was taking very little to no medication for the back pain at first. Unfortunately, about a year and a half into those injections, I had a really, really bad experience where the injections didn't go well and the process was extremely painful. It was traumatic, and I didn't want to have them done anymore after that because there was some shifting that happened with my back, and the doctor wasn't able to find the spot where the injections normally would go. And so he had to inject probably 4 times for each injection, which I would get 4 injections into my spine every 3 to 6 months, and they always hurt. I'll be honest. It's a painful process, but it was worth the relief that I would get for the 3 to 6 months. But the one time that there were some shifts and changes in my back that made it hard for him to inject in the spot that was necessary, and he had to do the injection 4 times with 4 different sites. It was one of the most painful things I've ever experienced, and it was just too traumatic for me to go through again. Just the possibility of having to endure that kind of pain, it was just not something I was willing to do. But in between those injections, I would take medications to help with fibromyalgia. So that doctor started me on slowly increasing it, but started me on taking a generic version of Topamax. And we upped that over time to reach close to around about 100 milligrams a day, I think is what I was taking. And that really helped actually with fibromyalgia pain. Like it really helped. However, it was a bit of a scary medication to be taking, because if after being at such a high dose, if I suddenly stopped or wasn't able to fill the prescription, you could experience some pretty severe side effects or withdrawal symptoms. And that happened one time. I wasn't able to fill the prescription. The doctor was out of town or something, and I wasn't able to get through to his office, and I completely ran out of the medication, and I ended up having a seizure, which is a side effect of suddenly coming off of that medication after being on a high dose for so long. So that wasn't the best experience, and it was a bit scary, but the medication did work for me. However, like I said, with the Lyrica, I had to stop that. So I went from Lyrica to, after a couple years of that, to the Topamax, I think is what it's called, the generic version of Topamax, for a couple years. And then I slowly weaned off of that just because it was too hard to maintain that large dose of medication. And the doctor that I was seeing was like 45 minutes away from where I lived, and it was just really hard to get to him often. So I slowly started to wean off of that, and just focused on taking, I think eventually I had a doctor prescribe me, I think it was Cymbalta for the fibromyalgia, which that did not go well. I had so many side effects of that medication. I would never take that again. I had severe side effects having nothing to do with fibromyalgia, and it did not work for me. It was supposed to help with fibromyalgia pain. It didn't. It gave me a lot of other, psychological side effects, because it is a psychiatric medication, but it's something that they will sometimes prescribe for fibromyalgia. So at that point, I was just taking tramadol and, my other RA medication, my TNF blockers, and like the methotrexate and things like that. And then, ibuprofen and Tylenol is needed. However, when I lost my insurance, when I was no longer able to work, and then I moved across country to North Carolina from California, I had to learn to exist without any medications or medical help at all. So during that time, I was definitely taking large doses of ibuprofen and Tylenol, and I was, fortunate enough to have somebody in my life who was willing to purchase a really high quality CBD oil for me to take, an oral CBD oil, which did help with the fibromyalgia pain, with the muscle cramps and the aches. When I had the funds to, I would also, buy magnesium to take magnesium as well, because that really helps with the muscle pain and aches and cramping of fibromyalgia. So here we are in 2022, and I finally have insurance, and it's not the best insurance, but it's insurance, and I'm happy to have it. And I am still trying to get a referral and get in to see a rheumatologist for the first time. I've seen a primary care physician quite a few times, and I've seen a GI specialist to follow up on my Barrett's esophagus, and everything's good with that. But I have yet to be able to see a rheumatologist. So one of the things that I've kind of been discussing with, a friend of mine, and kind of trying to work out in my mind once I am able to see this rheumatologist is, do I want to go back on pain medication? So the pros and cons that I think about is the pros, I will be able to get out more, to go on longer walks, to exercise a little bit more. I'll be able to work longer shifts through work with less pain. I'll be able to sleep longer with less pain, and just be more active, because pain won't be so far in the front of my mind all the time. Although that sounds great, you would think, well, if those are the benefits, what could you possibly, why would you not want to take medication? The downside of taking these medications is, number one, they're addictive. The tramadol and the Lyrica, they're both now controlled substances and are addictive, and you suffer from withdrawal symptoms when you stop taking it. I've had some pretty bad experiences of being on, at the end of me taking tramadol, I was taking 3 to 4 at a time of, I think it was, I'm not totally sure, but I think it was like 50 milligrams maybe that I was taking. And my prescription allowed up to 3 to 4 at a time to take just to sleep at night, or I'd take 1 or 2 midday just to help with pain to get through the day. I didn't realize that tramadol had a similar effect to the system as opiates, so that if you aren't able to take it and it gets out of your system, you will experience severe withdrawal. And because it is a controlled substance and your doctor's only able to write a prescription for so many refills, and every prescription has to be a paper prescription, and you have to take it to the pharmacy, and you personally have to pick it up, it wasn't easy for me to get. My doctor, who I wouldn't have changed for anything because she was absolutely amazing, my rheumatologist, was like 45 minutes to an hour away from where I lived. And so it wasn't something I couldn't just like run up really quick to go see her. If I was working at the time, I would have to take a day off to drive all the way up to get to her just to get this prescription refill. If it reached a point where I needed a refill before our next appointment was scheduled. So when my health started to really decline, and I was struggling to drive and I stopped working, or at first I was on short-term disability, I wasn't able, there were a few times where I was not able to get to her to get the refill, and I was taking so much of it per day that when it reached a point where I ran out of the medication, for me, I know it's different for other people, besides that feeling of something trying to claw out of your body from the inside, that feeling of withdrawal from medications like this, for me, it also intensifies whatever pain that I already feel, that I feel that the medication that is actually helping, whatever that pain that it was helping, it'll intensify that pain almost beyond what I can actually take. And I've dealt with that before when I've been prescribed narcotics for my back pain. And that process of withdrawal, going through that level of pain, made me never want to take narcotics ever again, because when you're in that kind of severe pain, you're willing to pretty much do anything to stop the pain, and that can be a dangerous place to be in your mind. And so I remember there being moments where I was going through withdrawal with the tramadol, that in the desperation and in the place that my mind was in, I wanted to cause myself some other type of pain just to distract from the pain that I was feeling from the withdrawal. And I knew that was very dangerous. And so a few times I had to take myself to the emergency room because I was afraid that I would hurt myself out of desperation for pain relief. And I just don't ever want to be in that situation again. And those memories are so vivid in my mind of going through withdrawal from just something like tramadol. And so I somewhat have a fear of ever taking high pain medications like that, like the ones that are these controlled substances, because of their addictive properties and the withdrawal that you can go through. So like fast forwarding all the way to where I am now in North Carolina. So being here, I said before, I've been, I was taking ibuprofen and Tylenol, and I was blessed enough to have someone in my life who was able to send me a really high quality CBD oil that I took regularly to help with the pain. Once I started working and had to be back on a schedule and moving around a lot more, that definitely helped with some of the pain. I created a schedule for myself of taking a certain amount of ibuprofen and Tylenol and fish oil in the morning, and then a certain amount of ibuprofen, Tylenol, and magnesium in the evening to help me handle the pain through my sleep. Now, through this time, in these years that I've only been taking ibuprofen and Tylenol, fish oil, and magnesium to help with the pain, I've learned to live with and adjust to the level of pain that my body experiences having rheumatoid arthritis and fibromyalgia. The pain has not gone away. It hasn't gotten any better. It's just that I build a tolerance to deal with what it's like to live in a body that experiences this much pain on a regular basis. Yes, it is very hard. Yes, it is debilitating, and there's a lot of hard parts about it. However, I have like an amount of pride in myself that I withstand the pain, and that I've learned to have a job, even though I work from home. I'm able to have a job, I'm able to work, I'm able to take care of my dog, I'm able to go on short walks, and I'm able to take care of myself, just regular self-care, showering, bathing, doing my own hair, cleaning up my apartment and doing laundry and all those things that are quite the struggle for people with chronic illness. I've learned to manage and do those things through the level of pain I deal with daily, and only getting assistance of ibuprofen and Tylenol, which take the pain from the regular 8 that it's always at to maybe a 7, 6.5. It doesn't relieve the pain, but it gives me just enough to bring my head above water and to function and push through it. Looking at me and knowing me and talking to me, you would never know the amount of pain that I deal with on a daily basis, 24/7, because I'm a positive person and I don't complain that much about my pain. And I want to have a more positive outlook on life, and it's just not helpful for me to constantly complain about it. And because I push through and move around as much as I can, it doesn't look like that. So it can be hard to be in that much pain on a regular basis and it not be visible to people. So if I know that I don't express pain the way people expect me to, or the way maybe other people do, so it's really hard to constantly be in as much pain as I am in and not be recognized or understood. However, I do still feel very proud of myself for handling my pain, and being able to push through it. So it's taken a couple of years of not taking any kind of special medications to help with the pain, to learn to tolerate it and function through it. All of that to say that one of my fears of getting back on pain medication is losing this tolerance, losing the ability to handle and deal with this pain the way it's taken me years to be able to do. And the reason why that's a fear is because everything in life is just so uncertain, and I don't know if I'll be in a situation where it happens again, where I lose my insurance or whatever the situation is, and I can no longer take any medication to help. So then I'd have to go through this process again of not only withdrawal, but learning how to function with that much pain when you've been having it. I mean, to be honest, no pain medication takes away all of the pain. It just makes it more bearable. And you get used to the pain level being lower when you're taking pain medication all the time. So you cannot, like, when you're like that, you can't stand where the pain is without that, And so I have such a fear of going back into a place where I've lost the tolerance to handle the pain as severe as it is for me and how my body just is. So I have some leftover Lyrica from a long time ago. I'm sure it's very expired, but it seems to still work. And when you've lost your insurance, you're desperate and you hold on to whatever you can. And through the past year or so, every once in a while when the pain is really, really bad, I will take some of the Lyrica. And recently, when I had some time off from work, I took some time off during the holidays, I took the Lyrica every day because I wanted to be able to get some things done and do things that I haven't done in a long time. And I also really wanted a full night's rest that wasn't revolving around pain. And I achieved that, I don't like taking the Lyrica. Because I don't take Lyrica often. When I do take it, it makes me groggy. So it's not usually an option for me to take during the day. But if I take it right before I go to bed, I get an amazing night's sleep with so little pain. And I wake up with so little pain. And I was enjoying it. And I kept taking it. And then, I realized that as I, starting to go back into work, that I couldn't keep taking it because it just made me too groggy. And I would wake up the next morning too groggy and it would take too long to shake it off to start my shift. So when I went off of taking it, and this is okay, I probably took it for like 4 or 5 days, so it wasn't that long. When I went off of taking it that long though, however, and I had to reacclimate to what it was like to feel my pain, it not only was it extremely hard to handle because I lost a tiny bit of my tolerance during those days, but also it was depressing. It was depressing to remember what my body actually does, how my body actually is, how much pain it's always in. Those few days of relief were so euphoric, and it was so nice to be able to feel like a normal person, to function like a normal person and be able to do things and when I'm saying do things, I literally just mean like cleaning and showering and doing my hair and taking my dog for a longer walk and just the simplest things, doing laundry, making my bed, to do it without so much pain and exhaustion. It was so nice to have a few days of feeling like a normal person. But the problem with that was that when I had to stop taking it, that reality check of being thrown back into this body that doesn't function well and that is always in a lot of pain was really hard to handle, and it was really depressing. And so I had to, I've been taking a lot of time to think, like, do I just want to continue to try to alleviate as much pain as I can through simple methods like ibuprofen and Tylenol, magnesium and fish oil, and try, keep doing things like right now I can only really do like chair yoga and stretching. I have an exercise ball that is really, really helpful. And, I spend a lot of money on accommodating my pain and my chronic health issues just so that I can work from home and just so that I can live. I wouldn't even say comfortably, but just so I can live, just so I can function. I had to spend a lot of money on a really expensive recliner just so that I can work a full shift without pain getting so bad that I needed to clock out early, or, that I couldn't handle my job, or, I work in customer service. You deal with a lot of upset people. And when you're in extreme pain all the time, you can't handle that. You can't handle people upset or yelling or all of that. So I invested in a really expensive complex recliner that allows me to work. Like, I know that sounds odd, but if you deal with extreme joint pain and all over body pain, you'd understand that like working from a recliner rather than a desk and a chair right now it's the only way I can work. I stopped being able to sit at a desk and work probably around Christmas of 2020. It became almost impossible for me to do. It was just so painful to sit for hours at a desk in a chair. It was just so painful. But because a recliner, I could go from different levels of reclining to sitting up to rocking to things like that. I knew that that was something that I needed, and I need to find one that fit my body and the places where I needed support the most. And unfortunately, it was an expensive chair that was able to do all of those things. But you know, there are just so many things as far as mattresses and pillows and all kinds of supports and shoes and things like that that I invest in to try to help handle the pain of just walking, of sitting, of standing, and doing laundry and sleeping and all those things like that. So my dilemma in question, and I would love for some of you guys, especially those of you who've been connecting with me through my fibromyalgia and rheumatoid arthritis story videos, to watch this video and talk to me about how you guys go through this process. You know, not everybody has the ability. I do feel blessed and privileged to have the ability to purchase things to help me control and maintain the pain level. I would love it if I had an unlimited amount of funds to, because I mean, if I could live in my dream situation that was low stress, was, you know, the perfect temperature that didn't exacerbate my symptoms, you know, a climate that worked best for me, that was lots of sunlight and open, like I said, very little stress, and I could purchase and buy whatever possible aids I need that would help me do everyday things, I could probably live without taking pain medication. That version of living would not be what a normal person does, would not be the way a normal person lives, but it would be good enough for me. It would be good enough for me to just be able to move through life and do some of the things that I love with less pain. Unfortunately, that type of lifestyle is a type of privilege that I don't have and I can't afford. So the accommodations I've made for myself so far are about the max of what I can afford to do to help myself manage the pain without prescription medication. So I wish I could have a higher quality of life. I wish I could be more social. I wish I could exercise more. I wish I could do more hobbies. But I feel like to get there, I have to be on pain medication. And then, of course, like I keep saying, the flip side of that is then you can't function without that pain medication. Not even to the level of what I'm doing now. You know, I remember the transition of going off of pain medication and not even counting the withdrawal part of it. It was the learning to exist with that level of pain. You know, it takes a long time to build up pain tolerance, just like when you're working out. If you lift weights or run or whatever you do, you know, it takes a long time to build up the pain tolerance to do your workout, you know, and then it becomes not painful at all, you know, and it just becomes an enjoyable thing. But to push through that burn and to deal with the soreness afterward when you're working out, it takes a long time to adjust to that. And it was the same to learn to adjust to my daily pain. Daily pain of just being someone with rheumatoid arthritis and fibromyalgia with no medication. It took years for my body to just recognize this is normal and function as well as it is. In my mind, I am functioning very well in comparison to what I was doing before. That transition process, I was basically bedridden for a very long time. I couldn't do anything. So it's the fact that I'm working a full-time job, even though it is from home, I'm still working a full-time job and taking care of myself and my dog and cleaning up after myself and showering and doing those things that are so hard. You know, that is such a huge accomplishment. And those few days I had of going on the pain medication, really, I mean, it was wonderful and terrifying at the same time. You know, it was so wonderful to feel that pain relief, but then it was really hard to remember that that's just not me. And so I'm still grappling with and struggling with and trying to figure out where that balance is and what choice I should make. And I haven't come to a complete conclusion yet. Will I go back on pain medication when the option is presented? Will I try just talk to my doctor and talk about different options that we have that are actually accessible to me to manage the pain another way? I know doctors will love to suggest, okay, physical therapy once or twice a week will be a great way to help manage the pain. It would be. It absolutely would be. Unfortunately, that's not an option for me. I don't have a car, and my insurance doesn't cover the type. Like, I have insurance, and like I said, I'm so grateful I do right now. However, it is very poor insurance that covers very little and has a very high deductible. And I know that it's not going to cover all of the physical therapy, you know, so it's just not something I can afford. I can't afford to 2 times a week or even once a week physical therapy, and I don't have transportation to get there. Yes, I can Uber or Lyft, but that's an additional, you know, expense that I don't have. You know, I'm so grateful to be working from home, but I don't make enough money to be Ubering and lifting to different places like that once or twice a week. I order my groceries to be delivered because I don't have a car. So although that would be great, you know, in a perfect world, I would have access to physical therapy multiple times a week. I would have access to a pool and or a hot tub and a steam room or a sauna. And, you know, those would be great ways to manage the pain. Those things actually help with pain management so much. I just don't have access to those things, and that's just not the lifestyle that I live. But I know from trying and doing some of those things when I can, that those are ways I can manage my pain without medication. So, you know, my prayer and my hope, my dream is one day to be able to have access to those kind of things and live without, you know, taking. Even the amount of ibuprofen and Tylenol that I take is huge. And it would be nice to stop doing that, you know? So if I had other ways, if I only took ibuprofen and Tylenol at night before I went to bed to help with the pain of laying still, because that's painful, and I could manage my pain through physical therapy, massage therapy, you know, heat, beyond like actually physically putting heat helps, and I do have multiple heating pads in different rooms of my apartment to help with the pain, but that's not the same, you know. And I take baths almost all the time, more than I take showers, to help with the pain, but it's not the same as something like a jacuzzi or a hot tub, a steam room, a sauna, or, you know, some kind of pool or aqua therapy. Those all will be great ways to manage pain without medication, but those things aren't accessible to everyone, and they're not an option to everyone. So I would just love to hear some of your thought processes of things that you wish you could do differently to manage the pain if you had that option, and also maybe reasons why you choose medication over trying some of these other options as well. Like, for me, I'm a single person without children, so I can cater my life around my pain management and how to take care of the chronic illness. But when you're married or you have children, you have other people you have to take care of and think about. And so taking medication may be the only option just to take care of your family and be a part of your family and participate with your family. And that's absolutely understandable. And, you know, we all have so many different situations. So I would just love to hear from some of you guys about how you work through this dilemma. And I know this has been a very long video, and I thank you so much if you've made it this far. Thank you so much for listening. Thank you for sharing your thoughts. And I will talk to you guys again soon. All right, bye.